All right, joining us from Capitol Hill, Republican Congressman Tom Cole of Oklahoma. Thank you very much for coming on the show this morning. How would you characterize what's happened over the past 24, 36, 48 hours? And where does the responsibility lie? Only for constructive reasons? Because it seems this has been an issue that's been extremely important to the Republican Party for many years, health care.
Well, I think it's actually extremely important to all Americans. Look, the system we have isn't working. Well, let me finish my answer, if I may. Look, we came one vote short of being able to continue the process of working on this. And so now I think it's really incumbent on our friends on the other side of the aisle. They keep telling us there's a lot of problems with Obamacare. We need to fix it, not repeal it. Okay, let's see what your fixes are. And I think we should sit down with an open mind and listen to them. But frankly, again, in my state, we're down to a single provider. We have a 69% rate increase coming. And we have, frankly, our hospitals are taking care of people and not getting compensated for than 31 other states they are. So this is not a system that's succeeding. Most Republicans believe that. We got something through the House. The Speaker said last night he was prepared to go to conference and keep working with the Senate. They came up one vote short, and I regret that. I don't cast any aspersions on anybody. I'm sure everybody voted their conviction. But look, if you voted to not proceed last night, you effectively voted to sustain Obamacare, and I think that's that's very regrettable. In my state, it's devastating.
Kasie Hunt.
Congressman Cole, we read earlier in the show from a column by Peggy Noonan, who essentially argued that the president isn't displaying masculine qualities, that he's dramatic, that he's weak. And this health care bill ultimately was sunk by John McCain, somebody who, as we know, has a long legacy as a war hero, and by two women senators, one of whom the Trump administration reportedly threatened after she voted no. So I'm wondering, as you watch this, what lessons do you think President Trump should take away from this?
Well, I think there's a lot of lessons for everybody to take away from this. And frankly, I'm not going to cast aspersion on the president. This is a congressional failure, not a presidential failure. We're the ones that have been talking about repealing and replacing for 8 years, not the president. And, we got our opportunity and we fumbled the ball. But the reality is we came pretty close. We're willing to keep working, see if we can come up with something else ourselves or work with our friends across the aisle. But frankly, the president was effectively right. This system is imploding, and now it's really up to Democrats to come forward and say, well, these are the places we think we can work together and fix it. And I'm open to that. I'm happy to do that. But I think they'll find it's a pretty hard system to fix. This Medicaid expansion versus non-expansion divide is really, I think, the real culprit of not being able to move forward. We have a lot of people at the state level that chose, to expand. The system's not sustainable. They're going to end up paying a lot more than they think they are. We're losing money hand over foot on it from a federal standpoint. So sooner or later, the day of reckoning will come. We tried to put that off. We tried to move forward with something different. So far, we haven't been able to. So if we can do something to fix it, I'm open, but I haven't heard any suggestions from the other side of the aisle.
I'm just curious, does the president bear any responsibility in the failure of this process?
Well, look, everybody that's in office has a degree of responsibility. But again, it wasn't the president voting last night. It was a decision by the United States Senate not to pass something and proceed to conference and continue to work. So I respect the decision. That's their right. I'm not critical of anybody. But at the end of the day, no, it's a congressional failure, not a presidential failure.
Tom, good morning. Harold Ford.
Morning.
Quick question. As Democrats, you said you want to sit down with them, and I hope they do sit down with you. What would be the one or two things, in light of last night's not passing the repeal, when you talk about shoring it up and fixing it, what are one or two things that you could start with Democrats you think you might be able to find common ground? Democrats have talked about a public option as an example and maybe some tort reform. Are there other things that you think that should be a part of that conversation to make it meaningful to start?
Harold, thank you. To pick up on your suggestion, tort reform would be a good place to start, and I'd be for that. I'm not for a public option. That's buying into a failing system. It's not like Medicare Medicare and Medicaid are financially sustainable. They're not. And so adding more people to a system that's already losing money, I think, is a big mistake. The biggest thing to me would be to sit down with the 19 states, and this is a big state, states like Texas and Florida, that do not have Medicaid expansion. They're not going to vote for it ever. And what are you going to do to help those states and those hospitals? That's, to me, issue number one. Number two, what do you do to keep the hemorrhaging of money? I mean, literally, we have a lot of state governors where they took Medicaid expansion, so they're literally not paying very much to ensure healthy people that are above the poverty line. They're expecting the federal government to pick up the whole tab. That will not be sustained indefinitely. So again, I'm looking forward to my friends who've been successful. I congratulate them. They've stopped the effort to repeal and replace, at least for now, and let's see what they've got. But if they've got some suggestions, believe me, I'm more than willing to sit down, but right now the system's going bankrupt, and in my state, it's hurting a lot of people.
John Heilemann.
Congressman, let me ask you a different question on a different topic. We're talking about health care. We're talking a little bit about tax reform. There's another event looming out there on the horizon, which is trying to raise the debt ceiling. You got a hard deadline at the end of September. The administration says they want to get a vote by before recess. Where does that stand? And do you think we might be headed for a different kind of crisis?
I think it's serious. I don't think we're going to get to the crisis level. I think in the end, we'll do what we normally do. We'll find a way to get there. Now, the administration, like all administrations, wants a clean debt ceiling, and most Democrats would be supportive of that. I personally would not. I want to do something to change the trajectory of the debt. So let's wait and see what they pair with it. But at the end of the day, I mean, this is like the perils of Pauline. I mean, you know how the movie's going to end. Pauline always looks like she's going to get run over by the train, but she slips out of it. And I suspect that'll be the case again tonight, or on this issue.
Okay, Congressman Tom Cole, thank you so much for being on the show this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.